So schizophrenia, which is another condition, is not the same, obviously, as multiple sclerosis. Multiple sclerosis being an autoimmune disease of the central nervous system, whereas schizophrenia is an autoimmune inflammatory condition that affects the brain. And one of the side effects in schizophrenics is that a lot of antipsychotic medications cause diabetes. It's actually one of the side effects is that elevations in blood sugar and increases in weight. And so if you're been diagnosed with schizophrenia and you're on these types of medications, the likelihood of you developing diabetes and complications from that diabetes goes up as long as you're on those medications to treat your schizophrenia. So again, you're trading one illness for another by trying to treat the illness. And so we look at research studies on using alpha lipoic acid in schizophrenic patients on antipsychotic drugs where they've had induced weight gain. So again, the drugs cause increased weight gain. What they did in this study, and this was, again, a double-blind placebo-controlled trial. It's a 12-week trial where they were giving 600 to 1,800 milligrams a day of lipoic acid or a placebo. And what did they find? A reduction in body weight and body mass index, so improvements there, that's good. They found significantly reduced visceral fat. So both a reduction in visceral fat and a reduction in total body weight just by taking alpha lipoic acid. Again, this trial was not implementing exercise or other diet or lifestyle parameters, just using lipoic acid. Another study on schizophrenics used 100 milligrams a day orally for 4 months and found significant improvements in neurocognitive parameters. So in essence, these people, again, the functional outcome, it's kind of like what we're talking about with MS, where they walked better. In this case, they had better neurocognition. They could think more clearly. And in this study down here, 500 milligrams a day of lipoic acid, this was a 3-month study, significant increase in plasma adiponectin levels. What is adiponectin? It's a hormone released by fat cells that regulates things like inflammation. So it's very important. High levels of adiponectin are actually a good thing. We want to see increases in adiponectin because it helps improve blood flow and blood sugar and energy utilization. But they also found decrease in fasting blood sugar or glucose and a decrease in something called aspartate aminotransferase. This is a liver enzyme. And one of the side effects of schizophrenic medications is liver damage.